Bismillah ar-Rahman ar-Rahim, my dear MRCS candidate. One of the very important programs that will help a candidate to pass the MRCS exam is VASAI Physical Trainer that I have created. This is H70 and this is the name of the server where the program is on it. And here you found on the left hand side the dashboard, and here is the program. So the beauty about this program that you can select any station. This is physical examination station and be trained on it. This is the selection criteria, and all of them are stations that come in the exam. Or you can, here I've added, you choose your station. So you put in the search bar, for example, carpal tunnel syndrome. You can see here, carpal tunnel syndrome. And you click on it, it will immediately open the page for carpal tunnel syndrome. And carpal tunnel syndrome is a hand examination. And you will get some information about it, about scenario, about the best checklist, about common mistakes, and you can change the lightning. So let us say the best scenario. Usually it comes with the scenario 49-year-old female computer analyst present with 4 months duration of burning, paresthesia, tingling, and nocturnal numbness in the thumb, index, and middle finger. And this is very important. Frequently waking her up at 3 a.m., shaking her hand relieves the symptom, which is flex sign. But we don't mention flex sign, but we'll tell you that shaking the hand relieves symptoms. Candidate instruction: perform a targeted hand examination for carpal tunnel syndrome. This demonstrate provocative diagnostic maneuver and state your definite management. Okay. Now you can press on checklist. Here I put the best checklist. Remember, wash your hand and confirm patient identity, obtain. And you always remember, I want BC pick. And this is immediate. Expose both upper limb, fingertip until the elbow. This is important. Exposure. Inspect both hands, volar and dorsum. Palpate temperature. Map sensation. You can see all what you need to do: motor power, perform a pin test, abduction policies, and perform Durkan's carpal compression test. Press on both thumb and flexor retinaculum for 30 seconds. This is important. And also perform a Fellin test, perform Tunnel test, and Durkan's carpal compression test, and complete the station. So here is a checklist what you need to do in this station. The beauty does not stop at this, but you can, after selection of the station, you can start the examination. And here at the end of the program, you can either record your examination 6 minutes over a video, and you can upload the video if you click here. If you want to do it live, you can do it live. If you press in this camera, it will have automatic open your cam, like here, and then you can concentrate on your hands, and then you can start the examination. So, good morning. I am one of the exam doctor for today. Can I check your name and age, please? Thank you very much. Can you show me your hands? Like this. Can you turn around? Okay, thank you very much. And then I will need to test the sensation with a cotton wool. Pass all over the right hand and all over the left hand. And I discovered that on the right hand, the thumb finger, index finger, middle finger, and half of the fourth finger, there is decreased sensation, and same on the dorsum of the hand. And then I will ask the patient to move their fingers to test the motor power, then expand their hands, and then can you do fill-in test, which is reverse prayer position? If you can maintain it 60 seconds, and the actor will say, ouch, the right hand hurt a little bit. And then I will do a tunnel test, which I will be press here, tapping, and this causes pain on the right hand. And then I will also do a Drunken's test, and I will look to the thinner muscle and the hypothenor muscle. There is no atrophy, and I compare both sides. Then I need, with a piece of paper, to test the motor power between fingers, both hands, and then paper test to hold the paper, try to pull it, good motor power. Okay, thank you very much. And you want me to help you up, and I will expose the patient until the elbow. You can see transcription is coming here of exactly what you said, and here you say end of evaluation. Now, all what I have done will now go for assessment. And you can see introduction hygiene, I forgot to wash my hand. I should say the computer to wash my hand. Patient exposure, I did not mention exposure until the elbow. So here you can get analysis of what you have done. And here you can get mark reducing error, blunders defects, and this is important to read, fail to verify patient verbal consent instant, fail trap. So I did not ask patient for permission. Is it all right to examine your hand? Then I did not mention that I should wash my hand. Now, major, do not inspect limp abdomen from the end of the bed before commencing physical feel. Did not. Well, I should examine the limb, and I should say by inspection, the hand looks no apparent atrophy. You omitted dynamic comparative palpable cycle both distal limbs. I should compare radial pulse right hand and left hand. Now, here is examiner gold standard performance. The candidate followed approximately 0 of the golden standard pathway compared to either Royal Court demonstration, exhibit proper starting ethics, clean, in speed, make sure to establish fluid routine under 5 minutes, allow sufficient time finding interpreted discussion. And here how to convert this performance to a clear pass. Immediate action, how to yield this, and examiner secret. So you can see I have given the advice. I've made the marking system to be difficult. I took 10 mark out of 20, so this is a fail. And the reason for this, I want your level as a candidate to be the absolute maximum. So that is why this is difficult. And here is demonstration library. You can have multiple videos to explain multiple ways of examining limb, and these are YouTube station. You can have practical checklist. You use a checklist of anything you want. For example, varicose vein. You get a checklist, varicose vein. What do you need to do? And you should remember them very well. And you can get a certificate of your achievement, how many hours you had achieved, because I am less than 1 hour, so certificate will not be issued because I'm less than 1 hour. So I haven't really got a credit, and I've also failed, so you wouldn't get any certificate to print. So I hope this program is a helpful program to all MRCS candidates making their physical examination skills to be absolutely to the best performance. My name is Dr. Muhammad Omar Farouk. I'm a consultant vascular surgeon, and I wish you all the best.